What is the uptake of the GLP-1 receptor agonist anti-obesity medications? And are there differences by patient demographics? Does daylight savings time impact public health? What are the Spirit guidelines, and what's in the recent 2025 updates? Hello, and welcome to our listeners around the world. Today is Friday, May 2nd, 2025. I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. Today, I'm joined by JAMA Deputy Editor, Dr. Preeti Malani. Hello, Preeti. Let's get started.
Hi, Kirsten. First up, a study by Dr. Bond and colleagues. These authors used nearly a decade of traditional Medicare data to compare spending for patients at accountable care organizations, or ACOs, participating in the Medicare Shared Savings Program and non-ACO organizations. The authors report that during the first decade of the Medicare Shared Savings Program, ACOs reduced spending with larger effects over time.
Dr. Owayagode and Kola emphasize the importance of evaluating alternative payment models in their accompanying editorial. They provide a helpful perspective on the Medicare Shared Savings Program that continues to shape healthcare.
Kirsten, you know that the Pediatric Academic Society meeting took place last week in Hawaii. JAMA published outstanding research articles on child health featured at the meeting in Honolulu. Dr. Carlo and colleagues contributed a randomized clinical trial about extended caffeine use for premature infants. Moderately preterm infants, those born at 29 to 33 weeks gestation, were randomly assigned to receive oral caffeine citrate, or placebo. The authors reported that extended caffeine treatment did not shorten hospitalization, which was the study's primary outcome.
JAMA also published a number of pediatric-focused research letters this week. Dr. Bogassian and colleagues report findings from their retrospective cohort study on infants born between 22 and 25 weeks gestation. They found a notable increase in active treatment and survival for infants born at 22 weeks. There's also an article by Dr. Chua and colleagues about the withdrawal of Flovent, or brand name Fluticasone Propionate, in January 2024. The authors found association between Flovent's withdrawal and increased discontinuation of inhaled steroid therapy among children previously using Flovent.
Moving back to adult medicine, JAMA also has a research letter about disparities in prescribing trends for Semaglutide and Tirzepatide. Dr. Kim and colleagues used the Epic Cosmos database to better understand prescription metrics between 2021 and 2024. They conclude that prescriptions for both drugs increased slightly during the study period, but the authors also note disparities in prescribing based on race and ethnicity, social vulnerability, and urbanicity.
Very interesting. Let's talk about some of our opinion-focused content. In their perspective article, Dr. Zhang and colleagues discuss the large language model DeepSeek's rapid adoption in hospitals in China. The authors share concerns about adequate regulation and propose 3 areas of focus when deploying AI-driven healthcare systems. In another perspective, Dr. Brennan and Professor Cole explain recent federal anti-discrimination law and legislation technicalities. The authors offer guidance regarding medical interventions that are supported by empirical data demonstrating differences in outcomes by patient demographic characteristics.
Interesting topics. JAMA also has another perspective article in the JAMA Climate Change and Health series this week. Dr. Alkanese and colleagues delve into how metered dose inhalers contribute to greenhouse gas emissions.
Let's talk about the JAMA Viewpoints published this week.
In a Viewpoint article, Dr. Christakis, editor of JAMA Pediatrics, and co-author Dr. Hale expressed concern for heavy media use among children and advocate for better prevention as well as updated definitions of media use disorder. In another Viewpoint, Professor Zettler and Cortez discussed the recent firings and layoffs at the U.S. Food and Drug Administration. They provide specific examples to explain why these recent events have created a crisis at the U.S. FDA. And in a third Viewpoint, Professor Lynch and colleagues write about how federal changes affect institutional review boards, including research support and infrastructure. They warn that recent downsizes to research ethics oversight have already begun.
Well, there are two more viewpoints to discuss. Dr. Ma and colleagues comment on persistent success of sugar-sweetened beverage taxes in Berkeley and Santa Cruz, California. And Dr. Kim and colleagues advocate to abolish daylight savings time. They echo statements from both the American Academy of Sleep Medicine and the Canadian Sleep Society that express concerns for public health effects of circadian rhythm misalignment caused by transitions to daylight savings time.
Listeners can get helpful documents on the JAMA website associated with this week's publication of the Spirit 2025 Statement, which contains recommendations for the key elements in the protocols for design and conduct of randomized trials. Spirit will be of interest to authors and readers as it has become the standard for how to report and evaluate trial protocols. This special communication contains important updates to the original 2013 guideline, including a section on open science.
The JAMA Clinical Review article this week is about non-cystic fibrosis bronchiectasis in adults. Doctors Barker and Karamuz summarized the diagnosis and management of this chronic lung condition. There's also a related JAMA Clinical Reviews podcast. And there's a JAMA Insights by Doctors Martin and Cushman on Factor V Leiden. It's a helpful article for staying up to date on the most common inherited thrombophilia.
Continuing with great clinical content, JAMA's patient page is about cardiac arrest in apparently healthy young adults. It includes common causes and treatment, as well as helpful instructions for bystanders. JAMA Medical News is also featuring two articles this week. Lead senior staff writer Rita Rubin writes about the federal government's plans to eliminate the use of synthetic food dyes in the U.S., and freelance journalist Emily Harris reports on the nutritional education gap in medical training and some emerging curricula for physicians.
Thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Daniel Morrow, Shelley Steffens, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.